Welcome in, everyone, and thank you for tuning into this week's recap of the Lansing Watchdog, your trusted source for small business news. As always, I'm Francesca Rocco Ellis.
And I'm Jacob Manning.
And Jacob, you have a couple of updates you wanted to give before we get started. Could you share those with us?
Yes. So our biggest piece of news this week is that we want to share with you that a major piece of our policy agenda is moving forward in the state Senate. Senate Bill 1011, which would allow small businesses to join cross-industry association health plans, is moving in the Senate. So we've been advocating for this change on a federal level for years. This year, we began focusing on changing state law to allow these sorts of arrangements, and we've had a lot of bipartisan interest in the Michigan legislature. The bill was introduced in the Senate by Senator Kevin Hertel, who is the chair of the Senate Health Policy Committee. The bill just passed out of committee last Wednesday on a bipartisan vote and is now headed for a vote before the full Senate as early as next week. We have issued a call to action, which appears in this week's newsletter or is available on SBAM's social media. We try to make it as easy as possible for you to engage with our calls to action. All you have to do is follow the link, enter your name and address, and submit, and the website will automatically send a letter to your state senator that asks them to support Senate Bill 1011. The website does allow you to edit the language that gets sent in the letter. So if you have a couple extra minutes, adding in some specifics about your own situation, your personal story, and how this legislation would help you are all stories that will help make the most difference. More information about this legislation is linked in the newsletter. We also wanted to remind you that because this is an election year, it is more important than ever that SBAM Small Biz PAC have the resources necessary to support candidates that support small businesses in Lansing. We can only do that when we have participation from our membership. And right now, we are very close to our donation goal for 2026. We're about $15,000 short. If you've recently donated to SBAM's PAC, thank you for your support. It definitely goes a long way towards promoting Friends of Small Business in the legislature. But if you have not yet donated, we would encourage you to do so. More information is included in the newsletter. And finally, we have some fresh breaking news that we wanted to let listeners know about, and that is that according to the Speaker of the House, as of today, there is officially a budget deal in place between the Senate, House, and Governor. The Speaker says that the deal will not require any new taxes, so we're definitely happy to hear that. But as time goes on, we'll get more information, so more information to come as the three sides hopefully finalize a deal before the June 30th deadline. Now, Francesca, kicking it over to you, we had some major news yesterday in the race for governor. What can you tell us?
Yeah, Jacob. So yesterday, President Trump endorsed U.S. Representative John James for governor, immediately reshaping the race. This endorsement prompted State Senator Eric Nesbitt, who's also the Senate Minority Leader, to suspend his campaign and back James, arguing that avoiding a divided primary is critical to winning in November. Trump praised James as America first and capable of delivering strong results, signaling clear alignment with his political agenda. The endorsement is rather notable since Trump had earlier expressed concern about James leaving his competitive congressional seat open. Trump also endorsed Michael Bouchard to run for James's open 10th congressional district seat, helping shape multiple races at once. Nesbitt and other Republicans, including former Speaker of the House Tom Leonard, suggested that the endorsement effectively makes James the clear frontrunner and called for party unity. However, not all Republicans are falling in line. Some critics argue that James is a two-time statewide loser and warn that his gubernatorial run could jeopardize GOP control of his congressional seat. Candidate Perry Johnson and others questioned whether Trump's endorsement will actually translate to a win. Former Attorney General Mike Cox says he's staying in the governor's race and plans to compete through the primary. Cox argued Trump's backing isn't decisive and raised concerns about James's political record and business history, and is betting that voters may still shift once campaigns intensify. On the Democratic side, Jocelyn Benson's campaign is framing the endorsement as proof James is focused on Trump rather than Michigan voters. The race is now moving toward consolidation around James, but key questions remain about whether any Republican challenger can mount a viable opposition and how much impact Trump's endorsement will ultimately have in a general election. Now, throwing it back over to you, Jacob, what can you tell us about some hospital bills that we saw introduced last week?
Yes, Speaker of the House Matt Hall introduced a four-bill package to lower hospital costs, increase oversight, and limit consolidation among nonprofit hospitals introduced last week. Nonprofit hospitals under this package of legislation would be required to cut private insurance prices by 10% within 14 days of the bill's passage, with future increases capped at the rate of inflation. Hospitals would need to justify any price increases based on actual cost drivers like labor or supplies. The bill would also create a new five-member hospital cost review board, which would oversee hospital finances, review budgets, and hold public meetings. The board would operate similarly to the Michigan Public Service Commission, which regulates Michigan's regulated utilities. Hospitals that violate pricing rules could face penalties tied to the value of their tax exemptions. The plan caps patient charges up to 150% of Medicare rates for uninsured patients and 200% for insured patients. Hospital mergers and acquisitions would require state approval and face limits on market share for the region. Approved deals would also require price reductions and would also have to include fees with steep fines for violations. The bills would also create a new fund, which is supported by these fees and fines, which would provide financial support to struggling rural hospitals at risk of closing. The package would also limit non-compete agreements for physicians in large hospital systems to improve access to care. Supporters say that this plan reins in healthcare costs and increases accountability. Critics warn that it could destabilize hospitals, especially in rural areas, and amount to government price controls. The proposal sets up a larger debate about how to lower healthcare costs without reducing access to quality. The bills have a committee hearing scheduled for Thursday, and we will continue to monitor as they make their way throughout the process. So, all right, that was a lot of information. Would you please close us out for the week, Francesca?
Absolutely. And with that, Jacob and I wish you a great rest of your week, and we'll catch you next week with more updates.